Welcome to this special interview. I'm Tamanna Inamdar. Today we're talking about an interesting and insightful survey by Apollo Hospitals on the Health of the Nation 2025. Speaking about this is Dr. Sangita Reddy, Joint Managing Director of Apollo Hospitals. Dr. Reddy, thank you so much for speaking with us today. Let's start with what are the highlights of this report and why have you put this report out? Let's start with that context first.
So, Tamanna, I think it's very significant for us to continuously monitor the health of the nation. Yeah. We are in a unique position in that we do treat and care for so many. And we believe it's our responsibility to analyze that data and to work in every way possible on prevention and how do we keep people healthy. So over the last 40 years, we've been doing a series of, preventive healthcare checkups. We analyze the health of corporations, of individuals. And this report, we started doing this on an annual basis about 5 years ago. It covers approximately 3 million people who had had preventive health checkups with us. But it also looks at some of the rural interventions that we're doing, and it's a culmination. But it is a very, significant data and statistics on the way the disease patterns are moving. And that's what we can highlight in this report.
And one of the things that, you can see in the report is the rise of fatty liver disease. And I found this quite astonishing because it's not linked, these liver diseases are not necessarily linked to alcoholism or concerns like that.
So clearly, Tamanna, that's an important one that you have, found. But let me kind of give you a bit of an overview.
Yes.
The headline point is that non-communicable disease, which is, cancer, diabetes, hypertension, strokes, all these, I'm accounting for about 70% of all deaths. And this used to be, it was under 50 and communicable disease were the ones which had the major, there were the major reason for death. But now non-communicable disease, which are by and large lifestyle-related disorders, they are now accounting for 70% of all deaths. So it's important for us to know. Now, hypertension, in about 4.5 lakh people that we specifically screen for various types of hypertension, 26% of them were hypertensive. Now, that's a significant number. We saw the rise of, parameters in women's health. The traditional things that we knew, that they have anemia, they have B12 deficiency, they have, various calcium low scores. But we also saw that post-menopause, there's significant rise in diabetes, almost 40%, their rise in obesity, and their rise in cardiac risk. That was very, very important. I will now come to the one that you were asking about, which is the liver disease. So you're absolutely right that NAFLD, non-alcoholic fatty liver disease, is now a public health concern. And we found that, about 2.5 lakh people specifically deeply screened for this. 65% of them had fatty liver, and 85% of that were non-alcohol related. So this is a significant aspect of predisposition of consistent high calorific value. And this is it's a public health concern, and we need to focus on this. The other one.
Let me just come back to the public health concern. And when you talk about a public health concern, first of all, a few things over here, that non-communicable diseases are now responsible for an outsized number of deaths is definitely worrisome, scary, but also that obesity-led or nutrition or poor nutrition-led diseases are on the rise. That is something which you would say is the big outcome of what you have found?
It is an underlying factor, a significant underlying trend, which is presenting itself in disease. So it's a significant causative factor. And so now obesity and the lack of sleep are also being included as a non-communicable disease. That is the extent of the problem that we're looking at. And just coming back to NAFLD is because of obesity and accumulation of fat in the liver region, and this also is insulin resistance. It builds insulin resistance, and therefore this diabetes and non-alcoholic fatty liver kind of are coming together. And this combination is, not only can we have enhanced liver disease, but the diabetes has systemic, degenerative problems across the heart, across the eyes, across the peripheries. So circulation to the limbs. Some people, result in uncontrolled diabetes can cause loss of limbs. All these are interrelated factors. And therefore, it's important for us to, highlight on it, prevent it, understand it deeply, and take all steps required for the prevention.
In terms of findings on cardiac disease, and I'm asking this because this is something that is always in conversation, especially post-COVID. Whenever we see more and more cases coming in of relatively younger people facing cardiac diseases, and some cases death, the question comes about COVID, and are we seeing a rise in that? Is anything in your data pointing to it?
So because the number of people who had COVID was so significant, we are not able to drive direct correlations between COVID and younger occurrence of heart disease. The fact is that heart disease are happening at a much, much younger age than we have ever seen before. And the sad other point is that 46% of heart disease are coming in asymptomatic. So that means there was very little early warning, leading us to understand that we must go in through all the known causes of cardiac ailments, screen for them early and preventively. Having said this, let me come back to the point you asked on COVID, which is COVID created systemic inflammation. And is there a linkage between this inflammation and the cardiac incidence? Is a strong hypothesis, but data has not directly as yet correlated and proven this. But I would still say that if anyone has had COVID more than once or twice, you've had your vaccination, it is important to monitor your cardiac condition right now.
That's a very important takeaway. What can this data be used for, Dr. Reddy? How would you like to see this data being used?
So quickly, two more, I think, startling, and what I wanted to point to was school and college children. We spoke about obesity earlier. Obesity is rising in school children and in college children. 18% of college students that we surveyed had hypertension, which is the new problem because of the stress, the quality of life, all kinds of things. And 26% of school children were obese. Yes, this is an urban population, it's an affording population. This is not the national statistics. And I also want to add that we correlated this with the work that we do in rural India, in the village that we take care of. It's a cluster of villages, Tavanampalli Mandal in Aragonda, Andhra Pradesh. Here, 68,000 people from birth through life we take care of. We do multiple preventive programs. I'm very happy to state that in all parameters, their parameters are about 20-30% better than the urban and the unmonitored population. So this leads me to, the fact that there is something that we can do. Again, even in the urban population, those who had taken our pro-health checkup and then followed through in what we call the health mentor, here 59% of diabetics were able to reduce their HbA1c level. Now, HbA1c is an indication of sustained high sugar or sustained sugar under control. So they brought this under 7, most of them in a period of 90 days. By most, I meant 59% of them who were on the program. 51% of hypertensives lowered their blood pressure. And this is another significant one because if you have high blood pressure, you are at a higher risk for strokes and various other cardiac problems. So it's very, very important to manage. And the other is 47% of overweight or obese patients who were, within our program were able to reduce their weight and come within normal BMI. Which is the normal standard for obesity. So the point I'm trying to say is that if we diagnose early, if we screen, and then if we give corrective appropriate mechanisms, we can reduce these scary parameters, which means we can then reduce the incidence of death because of lifestyle related disorders. And I move on to my last point, which is this is not only about a hospital group or the healthcare system per se can share data, can counsel, can help. But this is about the whole of society coming together. It's about individuals. It's about corporations working on how they give healthy food in their cafeterias. How do they encourage people to exercise? Do they do, online meditation to reduce stress levels or improve sleep? Besides corporates, it's about homes and families and individuals. Are you shopping healthy? And therefore, it's also about food regulation and definitely the kind of lifestyle and habits we are giving our children. Do you know that in one of the countries I admire for their statistics on public health and population longevity, Singapore, they never use refined flour. Everything is whole wheat, so that we're not giving this kind of food to the children. So there are steps like this at a policy level that can create a modification in the way we eat or we live, and therefore create better health parameters. So there is so much that we can do, but I just wanted to say on World Health Day that this is a collective responsibility of the whole of society. So can we all come together to create a healthier environment for our children to grow up in, a calmer, more peaceful, more holistic, more thoughtful society, and reduce the burden of disease. And we must also understand that disease causes a significant financial loss. So I think the World Economic Forum estimated that the cost of non-communicable disease is almost $30 trillion.
No, very valid points. Very valid points, Dr. Reddy, and you're right. This is an emergency in healthcare which we need to recognize, and I'm glad that you're highlighting it. But while I have you here, there is another economic emergency in a sense that I need your comment on with what's happening with tariffs right now. Tariffs now on pharma as well is what the US President Donald Trump has announced. We're speaking to businesses across the board on the kind of impact they see, and I have that same question for you.
So, Tamanna, you're absolutely right. The report did focus on concerns, but it also did focus on the fact that with appropriate care, in rural and urban India, preventive healthcare and good primary healthcare can enable us to reduce risks and therefore bring down these areas of concern. So on World Health Day, I look forward to all your viewers and everyone across our country becoming more health conscious, becoming more careful, and staying healthier. The mantra is health span, not just lifespan.
Absolutely. Thank you so much for your comments, Dr. Sangita Reddy, there on what the impact of tariffs could be, as well as, of course, the health study, which highlights the concerns of non-communicable diseases that we're seeing. Thank you.
Welcome to NDTV Profit. Metropolis is in focus today. Now, this is on the back of news wherein company is set to acquire the business of Dr. Ahuja's Pathology and Imaging Center. Now, this acquisition strengthens the presence of Metropolis in Dehradun, which is in Uttarakhand. Also, company recently did acquisition of Core Diagnostics, which is again a leader in oncology testing, followed by Scientific Pathology, the dominant chain in Agra, which was also acquired by a company, and now Dr. Ahuja is the leading diagnostic chain in Dehradun. Well, how benefit is this for the company? What will be the strategies laid down by the company and what's the future ahead. Let's hear it from the management. I'm here joined by Ameera Shah, who's the promoter and executive chairperson of the company. Hi Ameera, good to have you on the show.
Thank you so much. Good morning.
Good morning. Well, congratulations on the acquisition. This is the third acquisition, Ameera, after Core and Scientific that Metropolis has done when it comes to North India. Now, with this, where your North India contribution will now go from 8% to?
Almost 14 to 15%.
14 to 15%. Okay, so just wanted to have what kind of strategies have you laid down when it comes to, the acquisition of Dr. Ahuja's, and also recently you did Core Diagnostics, then Scientific. So what are the strategies that you are laying down when it comes to North India market, because it seems that you are very aggressive when it comes to North India?
See, Metropolis is already a leader in West India and South India. And it's very natural that we would want to now, increase our market share and our positioning of strength in the markets where we are challengers, which is, of course, North and East. North is a very exciting market. It's a large market. It's growing very quickly. And Metropolis has, over the years, already established a good credibility and authority for specialized testing across North. But to get deeper into the market, it was essential to also get into the routine B2C testing, where patients are walking into your centers directly, but you're not just working with the top hospitals and labs. So, we've done three actions, which we believe will help us a lot. The first one we announced was, of course, Core Diagnostics, which is the leading onco-testing, cancer testing platform in the country, where majority of its revenues come from North India. This will give us access to the leading oncologists all across the whole country, but especially North, and access to the top hospital customers in North as well. So that's one, of course, and we've closed that acquisition as well. The second one we announced was Scientific, which is a leading chain in Agra, where they had multiple labs and almost 20 collection centers almost across the city. And as the leading chain in Agra, we believe this can become a great hub and a regional sort of beachhead for that entire district and market. So now the scaling up will be about taking Agra and then growing all across multiple towns and cities all across the that region.
Right.
What we've announced today is Dehradun, Dr. Ahuja's lab, and all these labs are very high quality. They're ethical. They stand for good science. They're not very commercial labs. And again, with Dr. Ahuja, 80% of the business is B2C. They're leaders in Dehradun, and we would like to use this again as a base for growing all across Uttarakhand. So as you can see, we are creating sort of a string of pearls from Delhi to all across all the critical markets all across North, along with also greenfields that we ourselves have started. So while in UP we acquired Agra, we also had started 8 labs on our own in UP just this last year. The same in Uttarakhand, we have a few labs and collection centers as well. So the combination of organic and inorganic will be a great strategy for the North to really increase our strength and market share in the market.
Understood. Also, so Ameera, since now you have almost 112 crores of cash sitting on your balance sheet, are there any plans for further acquisition, maybe in North India or some other reasons?
We've already paid towards Core, but we still need to pay for Scientific and, of course, Dehradun. We'll be using the internal accruals for these 2 acquisitions at this point of time. And then obviously we will generate cash in the year 25-26 as well. And the goal will be to look at a couple of acquisitions, in this year of 25-26. So, one, of course, we've already announced, which is Dehradun, and, we are hoping that there'll be at least one more in this year to come.
Okay, so one more acquisition on cards. Well, also, Ameera, so I was just looking at, Dr. Ahuja's financials for FY25. The revenue stands at around 11.5 crore, which is, down compared to last year. Why I'm asking this is because you have given 3x price to sales. So you are acquiring this company at almost 35 crore. What is the rationale? Because you're seeing there's a degrowth when it comes to revenue. So what's the rationale of 3x price to sales, and what strategies you have in mind?
Harsha, there's not really a degrowth. It was 12 crores the year before. It's only a 50 lakhs difference. It's not significant at all. And that was because they stopped doing CT, which they were doing earlier, and now they're not running a CT anymore. Now they're running only pathology and basic radiology. So we don't have any issue with that. Fundamentally, it's a profitable organization, clean organization, high B2C, good science. And frankly, if you look at that, we are sort of paying a 12 multiple of EBITDA or a 3 times sale. We feel is a very fair price, for the acquisition. Obviously we are going to grow these businesses, and therefore we believe that the payback should be fairly significant.
Understood. And also, just want to know about the margins when it comes to, Dr. Ahuja's pathology. So, does this align with Metropolis margins, or can we see dilution in margins going ahead because of the core diagnostic acquisition? We are expecting some kind of dilutions on the overall company's financials. So, could we see more dilution because of this acquisition?
No, Scientific and Dr. Ahuja's are actually similar to company profile margins, so we don't expect there to be a dilution because of those two. But yes, because of core diagnostics, which was a break-even business, we will see some dilution in the first and second year, only because while we will make it from a break-even to a profitable enterprise in the first year, it will not be at company margins in the first year. So there will be a small dilution because of core, but we have to remember anytime you're doing acquisitions, all 3 of them will be EPS accretive from year 1. And you are to have adjusted the valuation we've paid to core. If you see core, we paid at 2 times or 2.2 times sales, because there was not a profit generating company. So generally, we feel quite comfortable with the values that have been paid for all 3. And we're excited about what we can do with it, most importantly.
Understood. Also, Ameera, now since you are with here, just wanted to have a conversation about the Q4 business updates that Metropolis has come with. Now Q4 is generally a strong quarter for you, but you have mentioned that because of the healthcare industry saw some weaker than usual performance, and industry challenges actually impacted quarterly and annual performance. Just wanted to understand what would have been the revenue growth if these issues were not there.
See, if you see our YTD growth till quarter 4 was close to about 12.5% to 13%, and quarter 4 was about 10%. So I think there's a difference of about 2.5% to 3%. We were certainly hoping that quarter 4 would also deliver a similar kind of a growth number, but it didn't because there was an industry slowdown, which has been across pharma, hospitals, diagnostics, is what we are gauging. Of course, official numbers are not out yet, so we don't know for sure, but that's been the sort of pulse of the market that we've observed. Nobody really knows what the reason for this is, whether it's economic slowdown, whether it's a Mahakumbh, whether it's seasonal changes, and whether it's just difficult to know. Because also you have to remember that some of businesses are more wellness-based, but most businesses in healthcare are illness-based, which means it's not really a control you have. It's about when the customer falls sick. And this is deeply impacted by weather patterns, by the extreme of temperatures, and holidays as well. So, we'll have to wait to watch what people come out with for Q4 business updates. But our sense is that hopefully 25-26 will be sort of a stronger year, at least for Metropolis.
Okay. On that note, Ameera Shah, so with core diagnostics and your own lab expansion, you're expecting a stronger growth when it comes to FY26. Can you quantify what kind of top line are you expecting in a percentage, and also margins, because that's what important is right now. So what kind of top line and margins you're expecting in FY26?
I don't think we'll be able to give a forward-looking growth estimate for profit and revenue, but all I can tell you is that we feel quite comfortable and confident about the year coming in. It's not only organic growth, which we expect to do well, but also these acquisitions, which will obviously play in the whole year's pro forma, and the synergies that we are able to get out of it. Again, margin is, it's very easy to maximize when you're not investing in the business. You can keep showing a higher margin, but what Metropolis has been doing is to sort of make investments in the business the last 4 years. We do expect there to be some margin accretion in 25-26 compared to 24-25, but very difficult to pinpoint exact numbers.
Yeah, got it. I understand that. Last question, Ameera, before I let you go, can you just wanted to have a perspective on pricing? In Q3, you took some kind of price increase. Any price hike or price increase that you've taken in Q4?
You can't do price increases every quarter, really. You're doing them once every year or once every 2 years. Actually, it was not taken in Q3. It was done Jan 1st, 2025. So it's really effective Q4, which was a hardly 1.5-2% price increase. It's not been very significant, but certainly something that we rolled out.
Right. Well, thank you so much, Ameera, for answering the questions, and all the best.
Thank you.